Welcome to Functional Roots, where whole body wellness begins in the mouth. I'm Amanda.
And I'm Heather, and we're hygienists with a passion for all things holistic, functional, and naturopathic.
This isn't your average dental podcast. Around here, we dig deep, past the plaque, and into the powerful connections between oral health, the body, and the way we live.
So, whether you're a fellow dental professional, a wellness enthusiast, or just someone curious about taking a more natural approach to your health, you're in the right place.
So, grab your favorite herbal tea, settle in, and let's get to the root of it all.
Awesome.
So today we are joined by Amber White. You might see her on Instagram as Naturally Amber White. Amber is a dedicated dental hygienist and a holistic health practitioner who found her true calling in biological dentistry. After years of practicing traditional dental hygiene, Amber sought to offer more comprehensive care for her patients and clients, leading her to discover the profound connection between oral health and overall systemic wellness. Her passion for deeper patient care and holistic healing drove her to explore functional medicine, enabling her to make a more significant impact on the health journeys of those she serves. In addition to her clinical work, Amber guides dentists in their transition to biological dentistry, helping them integrate holistic practices. She also collaborates with health and wellness professionals, empowering them to incorporate oral systemic health into their protocols. Amber has advanced her expertise through studies with the American College of Integrative Medicine and Dentistry and earned hormone certifications from the Institute for Integrative Nutrition. Today, she's committed to educating others on the importance of holistic health and guiding practitioners in transforming their approach to patient care. So let's get started. So, Amber, we love hearing origin stories. So initially, what drew you into the field of dental hygiene? And when did you begin to explore that more biological or functional approach to oral health?
Yeah, thank you both for having me. I'm so excited for this conversation. I actually went to hygiene school later in life. I had gone to school for psychology initially, and I worked in restaurants, and I had always been drawn to dental hygiene. I loved the idea of helping people, and I love the one-on-one aspect that dental hygiene brought, and just being able to really work specifically with each patient. I worked in traditional dentistry for about 3.5 years. That's it. I wasn't in dentistry for 20 years and then found biological dentistry. I actually found it early on. I started working in different practices, perio, general practices, and I just felt like something was missing. I just felt like I was giving this same treatment or seeing the same results or seeing like the same patterns between my patients. And I started diving deeper, more into nutrition initially, and really looking at how that impacts our oral health. And there was just this time where I was feeling like there has to be something else out there. Bleeding gums, inflammation, cavities regularly. This didn't feel right to me. It felt like there was something missing. And that's when I stumbled upon biological dentistry. I just found the IAOMT, and there happened to be a practice that was opening not too far from my house that was a startup biological dental and medical practice. And without hesitation, I just sent my resume and was like, I think this is where I'm supposed to be. And honestly, it just panned out that way. I was able to work with some of the best mentors in the field and really witness a practice from the ground up in treating patients in this way. And from there, I just went on this path of wanting to learn everything. I think once you get into a more holistic, functional, biological approach, there's no stopping what you can learn, and you just want to soak it all in.
So true.
Awesome.
So true.
So, I want to dive a little bit into the unicorn office that you are in. What treatment modalities, both on the oral and the systemic aspects, are you utilizing in your practice? Because you are in a super unique practice where you are tying both of those components in. Can you tell us a little bit about the amazing practice that you're in and what sort of things you are able to do within your office?
Yeah, absolutely. So I'm actually currently not working in that practice any longer, but it was a great way to collaborate. So we were able to, of course, on the dental side of things, we were incorporating so many other modalities like platelet-rich fibrin for surgery
Mm.
and laser, red light therapy, utilizing the cone beam for that 3D imaging. But also in the same clinic, we had nutritional IV therapy and ozone and also some energetic healing. So, structural healing, structural energetic therapy, really just a wide range of all the different healing modalities that you can think of to really calm the nervous system, help the body detoxify, and just set you up for optimal healing. So, definitely an amazing setup if you can be in that perfect, yeah, place where everything's all at your fingertips.
Amazing. Are you completely out of clinical now then?
I go back and forth, to be honest, because I definitely have gone further down these rabbit holes of mineral testing and hormones and all the different things. So I do work with clients that are looking to optimize their health, both through oral and systemic practices. So I do work more as a wellness coach with those clients, and I have been working with a number of dentists over the past few years who are making that transition. So in that practice, I initially was getting started as a hygienist, and I actually became the practice manager. So I was able to really work in that practice from the ground up and get things going in addition to all the healing modalities, but also marketing. And so I took all that I learned from there, and I've been working with practices, like I said, for the past few years that are making that transition because there's so much to learn and so much to know. And so it's been really amazing because this type of dentistry should be widely available. And so bringing more practitioners into this field is such a passion of mine.
I love what you said earlier. Just what you loved about clinic and hygiene specifically is the one-on-one. Like I look at all of our counterparts, the people consider us like the dental equivalent of nurses, and I'm like, nothing against nurses. Like, thankfully, they do what they do. They have such a difficult job, but I'm just like, I couldn't imagine like how you feel emotionally at the end of a day because you haven't made those same connections that we get to make with our patients if you're working traditional clinical hygiene. And even I do a double hygiene schedule, but I still get like such great quality time with my patients where I get to check on their lives, like emotionally, those patients that we have that great relationship with. And that is my favorite thing about what we do. So, what you said as far as getting to help patients and have that one on one time just sets hygiene apart, I think, from any other wellness professional out there. And I am on a similar journey with you. Obviously, we're all in this similar space, but I'm in functional medicine coaching academy through the IFA. That rabbit hole, once you start learning, you're just like, hold on, there's so much more that we can be teaching patients because yeah, it's not adding up. Nothing that we're doing is really adding up. There's always something new and research is going to come, but we're finding new ways to put a band-aid on a problem and not get to those root causes. And I think that's where traditional dentistry versus biological or functional dentistry is really diverging is how are we going about solving those problems? Band-aid approach versus root cause approach. So I'm excited and I love getting to connect with other providers that are making that same journey. And that's what our podcast is all about is really just getting to connect our community and I think bring awareness to, gosh, the traditional dentistry of, hey, this is what's possible. Think about what you're doing. Yes, there's really cool modalities out there in traditional dentistry, but are they fixing problems? I don't think so. Thank you for what you do. Thank you for the experience that you had. I'm jealous that you figured this out early on in your career and you got to get in there and get to work in such a cool, unique practice from the ground up.
Yeah.
I'm curious with your mineral testing, what is your favorite test to do?
I love to run the HTMA, the hair
Mhm.
tissue mineral analysis. It
Yeah.
just gives us so much information into the body at a cellular level. And I think so much in dental hygiene, we can see so much that's happening inside the mouth without any diagnosis, without anything going on. There's so many oral manifestations, but this actually takes it just a little bit deeper. Why are we not healing? Why are our gums inflamed? Why are we more prone to cavities versus just like you said, a band-aid solution.
I have a
100%.
follow-up question on that one. So I talk about vitamin D and K and A, and we know vitamin C can be super helpful for tissue integrity and bleeding points and things like that. So can you explain the foundation of the minerals that a lot of us don't really understand, those components and how those tie into gum tissue health, teeth remineralization, and overall health in general?
Yeah, absolutely. So it really lets us look at, and so with the hair test, it's not really just a straightforward test where we're deficient in something or we have an overabundance of something. It really shows patterns. And of course, fat soluble vitamins are so important for the foundation of our oral health, for our bone structure, our gum integrity. But also, we think about calcium a lot and we hear we need calcium for our teeth and our bones, and we do, but we also need these cofactors to drive calcium where it needs to be in the teeth and bones. So we need the vitamin D3, we need the K2, but we also need optimal potassium and phosphorus levels to actually utilize calcium in the way our body needs to. We also think of things, just an example of, say, dry mouth, which is very prevalent among a lot of people, especially women later in life as we go through perimenopause, menopause. And we know sodium and potassium regulate our hydration, but also our salivary flow. So looking at these little patterns can give us so much insight into what's happening inside the mouth, how we can support it, how we can like optimize salivary flow, because that's something so many people struggle with. But it also gives us patterns into how our systems of our body are functioning. And so if we see suppression of, say, our thyroid gland, which regulates our body, or our adrenal function, we know we have suboptimal healing. And so if someone's going through like dental surgery or extensive dental treatment or periodontal treatment with their hygienist, if we have these ratios out of balance, we know we're not going to have the optimal results. So it gives us tools to optimize the body before we actually bring in different treatment.
Awesome.
I know.
Um,
I'm just like still thinking of your practice and how reinforcement, like having a dental office and an integrated health office, like how that really had to set the tone for the patients that, like, yes, this dental office is taking oral systemic very seriously. And I think it's finally becoming a trend. More offices, dental offices are integrating like nutrition, chiropractic health, Chinese medicine, herbalism, all of these alternative modalities that have just been considered woo or crunchy for so long that we're finally like, oh, hey, maybe we aren't supposed to like scorch earth our whole body and just expect it to do okay running off of McDonald's. So just like really finally integrating, hey, these people are taking it seriously, and you have the medical side to support what you're talking about in the chair. How was that in your conversations with your patients when you're telling them, hey, this is what I'm seeing, and you're able to go refer them to a medical provider like right away to reinforce those recommendations?
Honestly, the setup is amazing to have that at your fingertips to be able to collaborate with these other providers. And I think collaboration is so key to this type of health and wellness and medicine. And I think that's something that we miss a lot in medicine. We refer out or we refer for a certain treatment or to a certain specialist, but to be able to actually collaborate on somebody's care and build a team that supports the patient is completely unique and invaluable. Now, that setting, of course, everything was in one place, but I do know a lot of dentists who possibly don't have all of that at their fingertips, but they build these strong referral networks. And that's something I work with my clients on too. It's like building that referral network to create the team for your patient is going to completely change their health and the trajectory of that. Because not one person is going to change someone's health. We all come from different backgrounds. We all have our own knowledge and expertise and also passions. And so being able to work with other providers, I think, just completely changes the game in optimal health.
Yeah, I, it's so true. I feel like it sends such a solid message when you have those other providers that you can just rely on, that they're reinforcing recommendations and they're on the same page and they're not going to try to thwart or undermine anything that you're talking about. And that I think that can be a challenge as a hygienist. Like I still work in a traditional dental office. I have some freedom to be able to make recommendations like myofunctional, and I have a couple other providers that I can send patients to that are interested in that. But I think you are absolutely right. Like having a network of reliable referrals that you can feel comfortable sending your patients to that maybe you're also going to see as a provider is such a good reinforcement for those patients to see that it's not just, my crazy hygienist that thinks she sees something, but hey, this is legitimate. And there are other educated providers that are at this different level looking at health in a more functional perspective instead of a disease providing facility. So I really appreciate your perspective and how you are able to have those conversations with patients and guide them to other providers for care. So I think that's such a really cool opportunity.
I think it's awesome. I've just started doing that collaborative aspect too with a lot of the practitioners that I'm working through with Bristol. It's like, okay, who do you have in your corner to do referrals for functional nutrition? Because if we don't deal with the gut problem, we're not going to deal with the mouth problem. And same thing with the airway. So that's one of the conversations I'm talking to a lot with the practitioners who I'm working with as well. We need to get that network going. And it's not just the referral aspect either. I'm working really closely with a functional nutrition or a functional doctor out of Michigan. And it's awesome when I can text her and say, hey, I need this patient to have a sleep study done. Can you run that for me? So that, and then giving her the insights. This is what I'm seeing in her tests. And after the conversations, I still think this is a problem and we need to address X, Y, and Z. So it's not just like here's the referral, see you later. Having some conversation with those practitioners and collaborating the care, I think is super amazing. For sure. Can you tell me, in your experience, how critical it is for practitioners to understand the role of hormones and mineral balance that play on the oral systemic connections? I know you mentioned with the thyroid, that being a big component, but we also have cortisol playing a role, and then hormones in general for like testosterone and progesterone. So tell us a little bit about the hormone component and how that can also play a role in our gum tissue health and maybe even decay issues.
Yeah, definitely. I'm obsessed with hormones. I have been for a long time, right? We all have our own health journey, and hormone health was something that affected me personally, and that was just something that I dove so deep into. But along my own journey, I just started to connect the dots between all the connections of what's happening in the mouth and our hormones. And so, right, we have hormone receptors in our gum tissue. So it's like hormones affect our tissue integrity, they affect our bone density, they affect our immune function, they affect our ability to detoxify. So they're critical in knowing this, especially, of course, in men, but I think, right, as women, we know that our hormones are shifting throughout the month and also throughout our lives. And so when we know we lose estrogen, we're more prone to bone loss and we're more prone to periodontal disease and things like that. We know cortisol patterns, we're decreasing our salivary flow. So with a decreased salivary flow, we know we're more prone to decay, we're more prone to oral infections and delayed healing. So knowing these patterns can give us so much insight. And then minerals really are cofactors for our hormones. So they support our hormone function. They allow the body to optimally heal. And so they work together. And when I look at mineral patterns, I'm also looking at how the body is able to detoxify, right? Every day, our bodies are detoxifying. It's our natural process. But we can see how our liver function is. And we know that the majority of our hormone conversion happens in our liver, but also we're detoxing through our liver. So that might need support. So it really just it's all connected, and especially in biological dentistry, when we're doing these treatments, say like mercury removal or oral surgery, we want to make sure the body is primed to detoxify and heal. So knowing these different things can really support optimal healing, which is always the goal.
Amazing. And as we're treating perio, get the opportunity to talk to certain people. And I had someone the other day that with her oral hygiene instruction and the co-work with the hygienist that she's seeing, her pH came exceptionally down, but her liver enzymes raised. So we had to talk about the Herx effect and how she probably has poor liver detoxifying impacts, and then clearing out all those microbes. We overloaded the liver and then have to support the liver in that component. And we forget about those detox pathways, and even just doing a full dump and trying to get rid of the pathogens that we're dealing with, we can impact that liver component.
Yeah.
I will be the dumb one in the room and say I don't think I knew that there were hormone receptors in our gingival tissues. I will just say that right there. What impact? Okay, if I did know that, I definitely didn't like put those pieces together for sure. So what is that direct impact that we're just going to see with maybe somebody that has hormones that are imbalanced? What would that manifestation look like for people?
So it could very well look like more bleeding gum tissue because estrogen actually regulates our blood flow. And so we can definitely see more inflammation, more bleeding response. We can see more bone loss as hormones shift. We can see, like I said, dry mouth. We can see so many different things as our hormones fluctuate. And that's why I know, like in dental hygiene school, I feel like we didn't really talk about hormones, but I just
Not at
remember
all.
the pyogenic
No.
granuloma in pregnancy. And that was like the big thing that I think maybe I've seen once in my career. But even preconception, what's happening inside our mouth is directly impacting our fertility. It's impacting everything. So there's so much with hormones that I think we're leaving out. And then men's hormones as well. When we think of biological dentistry or functional dentistry, it's like, what materials are we using and what is actually inside the mouth? And we know things like mercury impact men's hormones as well. They can have a major impact on sperm health, on all these different things. So it's just everything really is connected. And what I love is just being able to connect the dots and being like that little detective investigator. Like I get so excited to be able to be like, okay, this is what we actually need to focus on now because there's just so much that we aren't talking about. We never learned about in school.
No, absolutely. And we hear this so often, right? Oh, I didn't learn it in school. Is it important? And it's like school is just like to get you ready to like practice
Yes.
across the board because there's so many different types of practices out there. Like hygiene school's job is to get you ready to pass boards and to be somewhat competent when you step into your first practice. But I want to know a little bit more about the hormone side of things. So what you're saying makes perfect sense. Estrogen dominance, we're going to see more manifestation of periodontal disease. I'm curious, what about progesterone and testosterone? What are you going to see like oral manifestations? Is that something that you can look at that and go, oh, I wonder if he has this going on or she has this going on at all?
Yeah, definitely. It's a complex topic. And
Yeah.
we think about our sex hormones, but we also think about our thyroid hormones, our adrenal stress hormones, our cortisol. And we can see so many things going on inside the mouth, but we also have triggers inside the mouth that impact our hormones and vice versa. And I think that's the big thing with this holistic way of practicing is, for example, say a thyroid disorder. We have someone with hypothyroidism, we should be looking at what triggers inside the mouth could be impacting that disease process. So, periodontal disease, infections, root canals with recurrent infections. We also think of things like porcelain fused to metal crowns that have nickel because we have so much reactivity to these materials. So, it's like this back and forth thing where it's, are there things in the mouth that are triggering imbalance, or is the mouth so imbalanced that it's triggering disease in the body? And so when I know I don't even know if I'm answering your question, but when I take the approach, it's always a systems-based approach and really bringing balance back to all the systems of the body rather than necessarily focusing on one thing. But I would say the thing with hormones is that a lot of the things we see due to hormone imbalance are a lot of the things that we see naturally in our dental hygiene visits. So inflammation, bleeding gums, dry mouth, delayed healing after surgery, tooth sensitivity, so many things that can be driving it. And it's really just connecting the dots for them.
Yes. So as you were talking, it was really, you made me think. I'm going to share, I don't want to say a case study, but something that comes to mind. So I've been at my practice almost 4 years now. And I have this family, and I just saw the little brother to an older brother. So I've seen older brother, sister, older brother, sister. And the two boys, they've all had ortho. The first brother got out of ortho. He had the puffiest gums, but not like gingivitis puffy gums. It was just the papilla in the anteriors. And it wasn't like plaque, it wasn't bleeding. And so I was just like, this has got to be an allergy because he's not being negligent. There's not just like
Metal
puffy,
allergies.
right? Metal allergy. That was where I went. I was like, this has got to be. But it was weird because even where the brackets, not the brackets, but the bands were touching the tissues in the posterior, didn't really have puffy tissues. So a little bit weird. So maybe it was a different amalgamation of metals back there. So that was with our first doctor, who actually was biological, but he didn't do biological ortho.
Okay.
I digress on that one. But so we have a new orthodontist, definitely not biological. And we also have a new doctor who was just in on Monday when I saw little brother in ortho. And he comes in and he's, oh, we need to get his braces off so you can clean them really good. And I go in there and look and I'm like, except there's no plaque in here. There's not like calculus. Like what am like to what end am I going to clean these? Hey, maybe there's going to be some benefit, of course, but I was just like, this is allergy. But he's like a 13-year-old boy. So as you're talking about the hormone aspect of things, I'm like, puberty, allergy, all of these things is really what I'm curious about now. So when I see them next week for their ortho appointment, I might have that talk with mom of this is what I think going on. So we talked about, hey, he does need to do a little bit better with hygiene, but this isn't gingivitis. This is not like red, swollen, bleeding gum tissue. This is just puffy, angry at what's going on tissue.
And you can see, like, when you do a slide on those patients, like the white blood cells are all crazy, and there's really not a lot of pathology there. And that's where, yeah, I would say probably definitely the hormones. And then I see a big difference between metal and porcelain based brackets too for
Oh,
so many
interesting.
patients, especially with those with MTFHR issues where they just can't detox and they're having a hard time pushing all of that different aspects that they just can't detox from in them. And then Amber, let's just talk about the thyroid because everybody now has hypothyroidism. I've had it since I was 21 and the gut plays a huge role in that. And then we on the fluoride conversation, like how does fluoride impact that as well? Explain some of that part
Yeah.
of how fluoride and hypothyroidism is related.
Yeah, so fluoride suppresses thyroid function. It was
Mhm.
actually prescribed to hyperthyroid patients up until 1950 something. I don't know the date off the top of my head, but prescribed to suppress thyroid function. So we're reintroducing fluoride to our body every day. Even though we're not swallowing it, we know our mouth is vascular. We absorb ingredients. So regardless, so it's a halogen similar to iodine. So it actually displaces iodine, which is an essential mineral nutrient for our thyroid function. And so it can definitely have an impact on suppressing our thyroid function. Someone that already has hypothyroidism, introducing fluoride through our water supply, through our products, is only going to suppress that thyroid function further. So that's a really big thing for thyroid patients to know. Yeah, hypothyroidism is, I think it's 1 in 8 women develop hypothyroidism. Maybe it's like 1 in 4 men. Don't quote me. But we also know that 60% of hypothyroid cases are undiagnosed because the majority of hypothyroidism is actually Hashimoto's, which is an autoimmune variant of thyroid disease. And we also, like the statistics say, it can take up to 7 years for someone to be diagnosed with an autoimmune disease because our symptoms mimic so many other things with autoimmunity. So a lot of times our doctors will brush us off with these things, and really it's something that we really need to look deeper, especially as dental hygienists, right? We're looking inside the mouth. There's so many oral manifestations of hypothyroidism. And so just being aware of these things and also really looking at the medical history and just having conversations with our patients about what symptoms we're having. Yeah.
And getting doctors to listen
Mhm.
on Hashimoto's is incredibly challenging. And they pretty much is like an autoimmune disorder. We don't do anything. We just put you on hormones, which is not really treating the core issue. And I've had patients who have been able to heal their Hashimoto's. So there is a solution with gut health and making lifestyle changes that we can improve Hashimoto's, which improves oral health and systemic health in general, like metabolism, everything is relied on with the thyroid health. So thank you for sharing that.
Yeah,
Awesome.
of course.
And I think a lot of patients, I think there's a, I don't want to say a preconception out there that autoimmune is a life sentence and
Mhm.
don't realize that you can do things. You can do things that aren't just medications to reverse them. And definitely dental plays a significant role in helping with that. I think going to the idea of oral systemic, I think for a lot of patients, because they've been in the system for so long that our eyes are separate than our head and our mouth is separate than our body, with just traditional how insurance has decided to dissect the body. They just haven't put all of these pieces together. And so, Amber, when a patient comes in and is in care of a biological dentist for like the first time, and you start talking about all these pathways and all of this is connected and hormones in your mouth, what the heck? How do you go about having a conversation with educating a patient without just completely overwhelming them with all of this information?
Yeah, I always try to meet a patient where they're at and just like introducing topics. So I might say something like, when I see this, it can be connected to X, Y, and Z. So when I see this central fissure in your tongue or white coating, it could be connected to gut health. Have you noticed any symptoms with that? And just like introducing the topic. I had a patient where she had immaculate hygiene. There was no plaque, there was no tartar, and her gums were bleeding so heavily. And I just had a conversation with her where I was like, I said exactly that. I was like, your hygiene looks great. Like, you're doing an incredible job. When I see bleeding response like this, I tend to think that it can be hormonal because of X, Y, and Z. And I go into what's leading me to that, conclusion or that thought process. And so for this particular patient, I had brought up hormones with her, and she was like, actually, that's funny you say that because I had a hysterectomy 5 years ago, and my doctor told me in 5 years' time, I'm going to experience all the menopause symptoms. I probably won't experience it till then. She's like, I just hit the 5 year mark and I am having the most wild
Mm.
hormonal symptoms, like menopause out of control. And I'm like, this makes so much sense. We've been taught in school to place the blame on the patient that they're not doing enough. So if I
Mhm.
didn't know more, I might say, you need to floss more. You might just need to brush a little better. And yeah, you need to floss twice a day now. But really, like, why is this happening? Why do we have this chronic low-grade inflammation and this bleeding response? And it's not always what we were taught to think it is. So it's just always looking a little bit deeper.
I love this.
Yeah.
I have a webinar tonight, and the topic is like when we don't have the periopathogens, what's driving the disease? And I'm talking about gut health and airway in that component, not really bringing, there's only so much that you can cover, but I am going to sneak this in the back of my brain for the hormone conversation. I do talk a lot about hormones sometimes with like our perimenopausal women who have dry mouth and it leads to burning mouth syndrome. I think most of the time that burning mouth syndrome has a lot to do with vitamin deficiency issues and that dry mouth component. And we don't take care of that, then they just have this. And it's generally always those perimenopause hormone patients. Yeah.
Yeah. Yeah, and so many people really don't realize they're even in perimenopause because I don't know, I'm a 42-year-old woman, so when I was growing up, I didn't learn that in school. We didn't really learn about our hormones. And so I think most women I talk to will be like, maybe I'm gonna almost in perimenopause, and they're almost 50 years old. I'm like, you've probably been in perimenopause for a little while now, and you've had symptoms that we've been taught to believe are normal, right? As a normal part of aging, but in reality, so many people are suffering silently because they think it's just a normal part of aging. That's what they've been told. And they're really symptoms that we can alleviate and make better if we have more information and more awareness of what's happening inside the body.
It's true. I think everything I learned about hormones in perimenopause, I learned from Fried Green Tomatoes, the movie. Do you guys remember that scene where like the teenagers like cut her off and steal her spot in the parking lot and she just loses it and like bashes in the car and she's, I'm older and I have better insurance. Like, and then
I did
Anyway.
attend a class that the whole topic was menopause, and she wrote a book. The topic was a dental conference that we went to, and she was talking about menopause in that component. But we don't hear a lot.
Mm-mm.
Amber, what are some of the ways that we can help with hormone balancing in that perspective? Because as someone who has gone through a hysterectomy as well, who has Hashimoto's issues, my doctor didn't want to touch me with a 10-foot pole. So now I'm in a functional medicine nutritionist care, and I have my doctor running the tests for me, and she's like, I don't know why you want me to run these tests because I don't know what I'm going to do with it. I'm like, I just need you to run them. Like, I'll have somebody
I'm
else
just using
read
you.
them and help me. But how do we help with our hormone balance as we are those perimenopause or menopause women and we're headed in that way, or we want to help our patients? What are some of the key things that we should know as practitioners there?
Yeah, I think number one, yes, we can give our patients so much information. And if you have the education in hormones, I think you can give them tips and advice. But I also think this is where like that collaboration comes in too, and having those people that you can share these cases with. In perimenopause, things are going to shift. Things are going to change in our body, and what worked before is not necessarily going to work anymore. And so nutrition is going to be a huge piece to that, but also our stress response, right? We live in a very toxic world. We're exposed to toxins. So we can think about stress as, oh, I feel this pressure, this stress, but everything we introduce to our body is a stressor as well. So chronic stress on the body would be impairing our body's ability to detoxify. So I'm always going to talk about detox pathways and how we can support that. I'm always going to talk to my patients about if they're going to the bathroom regularly, if they're sweating, how well they're breathing, what their liver and kidney function looks like, how their lymphatic system is moving. Those are really foundational things that we can do to, it doesn't sound like we're supporting our hormones, but we are, because we need our body to have the ability to detoxify and self-regulate and heal. And of course, we know like the hormone conversion happens in our liver, and being exposed to toxins through our air, through our food, through our water supply, through our clothes, our products, our liver takes a brunt of that. And so I think always supporting our liver, whether that be with specific tinctures or teas like dandelion root or milk thistle. We can also do like castor oil packs can be amazing. Supporting our lymphatic system, that detox pathway, so we can do rebounding, dry brushing. There's so many, walking, there's so many things that we can do. Also, our nervous system plays such a role into our hormones, and we all have a kind of a preference, or our body tends to fall on one side or the other, parasympathetic or sympathetic. And so knowing that, the hair test will actually tell us like where we fall on that as well. But knowing that, we want to create resiliency in our nervous system that's going to support our hormone pathways as well. And so many people don't have that because we live in a very sympathetic driven world. We're on the go, we're having these feelings, but so many women that I work with tend to fall more in parasympathetic, but almost to a fault, where we get to that point of burnout, fatigue, low energy, brain fog. So things that we can do to stimulate our vagus nerve or to bring resilience to our nervous system. Like I love somatic movement. There's so many different things. I'm really into guided meditation right now, but there's so many things that we can do. I always just encourage people to find the things that they benefit from. Yeah, there's just so much. It's all connected. Morning sunlight, setting our circadian rhythm is going to help our hormones. So there's little things that we can recommend, but I always personalize it to each patient, so it's hard to say, okay, this is what we can say across the board, because I'm always like, okay, maybe we have hormones, but maybe we have gut health, and maybe we have nervous system dysregulation. So it's how do we tie all of this together in a actionable plan, but also a sustainable way?
I love that. It's a continuation of just hygiene care. It's a continuation of treating each patient as an individual and not one size fits all times 1,000, because it's more than just the mouth, because it's connected to the whole body, as we have been talking about. And we learned the concepts in school. I think we learned that, oh yeah, these oral pathogens can affect this, that, and the other. And we know we have all that research, but we don't talk about the body influencing the mouth as well, and just how it's not just a one-way tube. It is all connected. And I think this needs to be more in the conversation in hygiene schools and dental schools for sure. But speaking of school, and you brought up air, let's talk about Airway. So you're not so much chairside anymore, but what signs are you looking for when you're dealing with your clients or your patients that suggest mouth breathing, sleep disordered breathing, or airway dysfunction? Let's just open up the floor for that.
Yeah, definitely facial structure, tongue posture, wear patterns on teeth, localized bleeding response, shape and size of our palate, but also looking into the symptoms, right? Are we waking up feeling rested? Are we waking up with headaches? Are we clenching and grinding our teeth? So, just so many things to look for there. But I think once you start going down that path with Airway and with that, we can almost just look at a patient's facial structure and have some insight into there might be some imbalance here. Of course, like mouth breathing and things like that as well.
I work with a newer grad. He's 2 years in now. We have a new guy, but Dr. Wagner is like my favorite guy that is leaving us. And he's been along for my crunchy journey, and we respectfully disagree on some things. Like, he is still so pro fluoride, and I'm like, one day, sir, you're gonna call me in 5 years and be like, oh my gosh, you were right. And I am just waiting for that call. But until that day comes, I was at a computer yesterday typing notes, and he was around the corner, and our receptionist came up to him and said, hey, I'm thinking of taking my son to a dental office here in Salt Lake that is a pedo office, and they're like a super cool office, to have him look at Airway, because he doesn't need his tonsils removed, but he is just grinding the heck out of his teeth. And you could have blown me over with a feather. He said it. He said, oh yeah, you should look at Airway. And I immediately peeked my head around the corner, and I was like, did I hear you say Airway and not fluoride? And so he just looked, because it's finally becoming a conversation in dentistry. So my DSO, we get a lot of our CEs through Spear Education. And Spear is finally talking about how Airway is the future of dentistry. So they're finally getting there. But I was like so excited. That's even a conversation that doesn't sound like a nut job, because I have disagreed with him respectfully when I see a patient that is doing just insane amounts of grinding, especially kids, because the old adage was, oh, they'll grow out of it. Like, why would they grow out of it? If they're literally not growing correctly, why would they grow out of it? So having this finally, like, this paradigm shift within my doctor, who is very open-minded, was really exciting to hear. But for patients that just can't quite get their head around grinding, meaning they're not sleeping well at night, if they are not aware they're not sleeping well, how do you go about having that conversation with, say, a dad? Moms are a little bit more receptive, because you start talking about bedwetting and they're like, yes, I'm in. But what about if you're talking to a dad that is just like maybe not fully engaged? How would you go about having that conversation?
I feel like honestly, the same way I would have any conversation is just exactly like just introducing them to the concepts and the thoughts around it and asking those questions as to why. There's so many things that we chalk up on as normal, grinding our
Yeah.
teeth, snoring, sleeping with our mouth open, all of these things. I feel like with the dads or the men, I do tend to, and I always will share more studies, right? I always want to back everything I say up with the research. And so sometimes in those cases, I might introduce some statistics or some studies or even like print some things out where it's like, we know this is all connected and this can give you more information on that and put the ball in their court. You're going to be working with these patients long term. If they're your regular patients you're seeing every 3, 4, 6 months, I think it's just introducing the conversation and then allowing them to do their own research. I think every patient should be their own advocate and should do the research for themselves, but sometimes we just don't know what we don't know. And we have always been led to believe that certain things are normal. And so it's just you opening their eyes to these conversations. And I think vice versa. I think so many patients will open our eyes to different things that we don't know. And we always have to be willing to be open to new information, to be open to new concepts, and always be learning. And it's easy to get frustrated when so much and you're so passionate, but I also think they have to catch up because they haven't really gone down this path yet. And so with biological dentistry, holistic dentistry, I will say overall, the women come to us first and then they bring their families. And so I think they are more open. We tend to be more open. We tend to be more investigative and looking into different ways to heal. So I think it is the same way, but I do tend to lean little bit more heavy into the research, probably in a case where I might get put up against some more resistance.
I think everything you said just made perfect sense with, I mean, so many ways. I think my biological journey did start with patients challenging me on some ideas and just opening my mind to things where it was like, okay, this makes sense. It's your, I don't want to say your body, your choice, but I'm here to provide and educate, but you get that decision. And so I like when you say the concept, like everybody's on a different journey and some people are further than we are. Let's just be real. But there are other people that just aren't there yet, and you are probably opening their mind to potential that they've never even considered. So going back to that idea, you meet the patient where they're at. I do love that. And having research to back it up, yeah, because men are typically more analytical. They're not the emotional driven that we are, but definitely it's so funny when you say the women are usually the ones to come first. Every conversation that I have when I'm working at conventions with Guru Nanda, it's always the dentists that are like, oh, the moms are asking for non-toxic things. The moms want this. My crunchy moms want that. It is the moms, the consumer moms, the maha moms that are driving so much right now in healthcare and just in how consumers are spending money and what products are thriving and the new ones that are coming out. It's so interesting and cool.
And I think as practitioners, as we start to learn and be open-minded about those things, once you see airway issues, you can't unsee it. Like just walking into the grocery store and seeing kids with these dark bags and their lips open, I'm like, oh, I can help you. Let me help you now. Yeah, so I think that's it. Airway is, like I said, there's the triangle, the mouth, the breathing, and the gut are like tied together. You can't treat a person without looking at all three of those aspects because sleep increases. If you're not getting sleep, you can't heal because you're not getting into REM sleep. And same thing with our perimenopause women. They're probably not getting sleep because we have hot flashes and we have all these other things going on, right? That disrupts our sleep and our circadian rhythm and then increases cortisol. And then we're not getting into REM sleep and then we just don't heal in that component. And same thing with sleep apnea. I just had someone the other day that I was asking about, and I think his airway is probably an issue. And I asked him, like, how many times in the middle of the night do you get up to go to the bathroom? 2 or 3. I'm like, he's older, so he's just chalking it up as that's just normal because I was like, actually, if you're waking up from sleep apnea issues, that wakes your bladder up, which it's supposed to be shut off at night, and then it fills, and that's flagging you that you might not be sleeping well. In that, just small signs, and same thing with bedwetting for kids. It's the same concept. It's just as adults, we recognize that we have to go to the bathroom and get up. So those are one sign of possibly some airway things when we start asking more questions of our patients. Super cool. How does stress and trauma and inflammation play a role in healing? Can you give us some ideas? Because stress from not sleeping and things like that, but also just stress in life in general might have an impact on our health as well. Can you just kind of give us some information on some of that?
Yeah, definitely. Stress is debilitating. It completely impacts our health. And if we talk about minerals, stress depletes our body of so many minerals and nutrients that we need to thrive and have optimal health. So that alone, we're losing so much that our body needs to thrive. But also, when we're under chronic stress, it changes our actual chemistry of our body. It changes how we're able to digest our food. If we're living in a stressed, chronic stress state and we're in that sympathetic, our body's ability to digest our food effectively is impaired. And then, in turn from that, we're not able to absorb and assimilate the nutrients that we should be getting from our food supply. Cortisol patterns, right? We hear so much about high cortisol. It's everywhere. If you're on Instagram, everyone has high cortisol. They have the cortisol face, they have all the things. But honestly, so many people are actually the opposite, where they have low cortisol because they've been in this chronic state of stress for so long. And some of their symptoms mimic each other. And so we can confuse them easily. But we do want to know those patterns because if we're just suppressing cortisol and we already have very low cortisol, we're going to create a much bigger problem for ourselves. That I could go on a whole nother tangent about this kind of blind supplementation and just following what other people are doing without knowing our own body. But yeah, stress completely impacts our healing. We're going to have a more delayed healing response. In holistic dentistry, in the offices that I've worked in and or the dentists that I've worked with, a lot of them are doing a lot of surgery because we have that cone beam 3D image that's giving us so much more insight into these hidden infections in the mouth. And so, in order to heal optimally, we need to be in parasympathetic mode. That is our rest and repair mode. And so, stress, if we're in a state of stress when we go through any treatment or any surgery, we're not going to have as optimal healing as we could. So, that's just something we always want to think about is activating that parasympathetic response leading up to any kind of treatment or surgery.
The hidden infections. Can we dive down that hole for a second? Most people don't understand cavitations. I'm assuming that's what you're talking about is cavitation infection and how that impacts our systemic health in general. When we have those low-grade infections in the bone and the bone has a blood supply, those bacteria end up other places and can impact things. I've had one of my patients open my eyes to like how powerful treatment of cavitations can be because his psoriasis went away within a week of treatment, which was insane. So it's not woo when we're talking about cavitation issues, but just give a general overview of cavitation and tell us how you're treating it and what the treatment process is.
I just want to point out really quick, this is like hot button right now because the guy that did Fig, I totally forget his name every time, did a post about it, and another very mainstream doctor did a counter to he needs to be sued. Patients should not ever be given treatment for this. That is ridiculous. This is fairly hot button. Before becoming a biological hygienist, I was like, that sounds insane. And
It's
had I not seen the pictures and pre-post from an office down in St. George, I don't think I would have ever believed it. But once you
yeah.
see it, you're like, oh my gosh, yeah, what else could that possibly be?
And if you do your research and read, I have a cousin who's severely impacted by trigeminal neuralgia, and it happened right after dental treatment. And every time she goes to get dental treatment and has anesthetic, she has a huge flare up. And she's been through a couple surgeries because of it. And I think I try to get her to go to a holistic office in her area. I think it has to do with wisdom teeth cavitations that she probably, when you decrease the blood flow in that area, then it impacts that nerve because it's probably really close to the nerve in that perspective. So there's a ton of research behind cavitation, and there's some really cool doctors who are treating it. Amber, so cool that you've been in an office that does that treatment. And I fully believe after being in holistic dentistry on the power of treatment.
Yeah. This is definitely right. It's a very complex topic. It's definitely a hot topic, like you're saying. This and root canals, these conversations, we can find people on both sides. And I'll be honest for myself, I'm not going to be extreme on either side. I'm going to fall somewhere in the middle and personalize everything that I guide patients or clients on specifically what's happening for them in their health. Now, so when I say silent infections, yes, cavitations, but also recurrent infections around root canal teeth. We see a lot on the cone beam x-ray. So traditional x-rays, right, that 2D flat image, we're not going to be able to see in between the roots of the teeth. We're not going to be able to see what that bone density looks like. We're not going to be able to see as much. You could have been having x-rays for many years and everything looks normal, but maybe you had symptoms, or maybe something just never felt quite right, or you have this systemic health issues going on. Cavitations tend to have no pain. They're painless. That's why we call them silent. We don't know what's going on. And if you have a reinfected root canal, the nerve and the blood supply, the life supply of that tooth is gone. So you should have no pain on that area either. And that's why these go undetected for many years. With the cone beam image, we're able to actually identify these infections. So cavitations, yes, for the most part, they stem from wisdom tooth extractions, which has become a blanket treatment that everyone hits a certain age and you get your wisdom teeth out. And a lot of this also, we can go back to our airway conversation and how our jaw is developing. And we really should have room for all of these teeth if we're eating optimally and our jaw is developing optimally. But yeah, a cavitation really, so we think of a cavity as like a demineralized area or hole in the tooth. A cavitation is actually a hole or area of the bone that hasn't healed fully. So, you know, we have these cells, osteoblasts, osteoclasts, which stimulate our body to break down bone, build it back up. And so after an extraction, the bone should fully heal in that area. Oftentimes, we can have the periodontal ligament left behind, which is the ligament that surrounds the roots of those teeth. And so, having that there, it's not triggering the cells to go to that site and build the bone back up and heal. The sites have no blood supply, they're stagnant. And so, they create a space where bacteria, you talk a lot about bacteria can thrive. Parasites can thrive. Lyme spirochetes are a big one that's found in there. And so when we test these sites, we can actually test and see what type of bacteria are present. So that's really interesting to see what's going on there. But we do see it, I wouldn't say we see it all across the board, but I would take a very whole body approach, a very personalized approach. I think everyone who's had their wisdom teeth out should have a cone beam just to evaluate and see what's going on there. But we all also have our own constitution and our own ability to self-regulate and heal. Some people can have a root canal and be completely fine, where others, we're creating imbalance in the mouth for them. So everything really needs to be personalized. We all have like our toxic bucket, like we can tolerate so much. There are some people, I don't know how they do it, that can tolerate all the toxins and all of the things and feel great and look great. And then there's others who one little thing is going to tip that for them and completely impact their health. So it's really just looking at everything from a personal lens and also giving the patient all the information to make that informed decision.
Amen. Yes, I agree.
I think you said the key word there, informed decision. You're never
Yes.
forcing a patient to make any sort of decision, but informing them because this isn't mainstream at all. So I love that. I absolutely love that. What do you, I think just one like follow-up question, not so much with cavitations, but just in the realm of education for hygiene, not so much just in school, but what do you think hygienists aren't being taught but should be taught when it comes to whole body oral health?
I think we are taught about the oral systemic connection, but I don't necessarily think that we are taught how intricate that really is,
Mhm.
how big of a role that we play into that. I think that we're taught, I know being taught about nutritional counseling, but are we really taught to really guide our patients on what is best for that? Nutrition, lifestyle, these things are going to have the biggest impact on our health. And so I think being able to ask the right questions to be able to actually have conversations with our patients. I think a lot in school we're taught is like time management. And I don't always tend to be the best on time management because I'm always like, I want to educate. I want you to leave here knowing so much more than what you came in. But I think it's that is being able to ask the right questions, being able to identify different things. I think so much of what we're taught is like these anomalies. And I think it's important, of course, to be able to identify potential things like oral cancer or potential other oral manifestations of disease. But I think we miss out on some of the things that are so prominent, are so common in almost every patient, and being able to identify those things. I just think that we could go deeper, that we could learn more. I think hygienists are underutilized. And I think that we are all passionate about something. And I think it's allowing that. Now I'm talking about dental offices, but I think it's we need to allow hygienists to bring in those other topics and those other conversations because that is really what's going to transform people's health. That really is going to be what allows patients to feel held, seen, heard. And that's a huge part in a patient's healing, is actually feeling that for the first time.
The power of a registered CODA certified dental hygienist. We need licensed dental hygienists to do
Yes.
this job. We're in a hot spot right now, and I think that's an awesome way to wrap up. Like, dental hygienists are so important for both oral and systemic health. I think that's just amazing. If we had one piece of advice for just general listeners on how to approach oral care more functionally, what would that advice be for a general listener?
A general listener, I think I would say start with a mindset shift. I think we've all disconnected our mouth from the rest of our body. And so I think a mindset shift and understanding that it all is connected and you can actually transform your health by just opening your mouth and looking inside to what's happening. But I think from a habit standpoint, I think creating a ritual around your oral care is really important. I love the idea of creating something that feels so good. Like we talk about these 10-step skincare routines and things like that. But I think creating this ritual around our oral health where we actually stimulate our vagus nerve prior, we put on like binaural beats or a meditation or something that we're actually grounding ourselves into parasympathetic. And then, of course, I think everyone should be tongue scraping. That's a no-brainer for me. Cleaning out your toxic products and only introducing things that are biocompatible, body friendly. We do need to floss. I think vitamin C, the majority of people should be taking some amount of vitamin C to help with tissue integrity. But I think there's so much you can know. I think the most powerful things will be to shift your mindset, create a non-toxic routine, and become your own advocate.
It's a lot of powerful information and practical skills. Practical skills. I think when we start having these conversations, it's so overwhelming and it's yes, it's
Mhm.
gonna like you're gonna transform everything, but you're right. It starts with a mind shift. When you change that mindset and it's not, oh, I can't do this anymore. It's I'm doing this for my health. I'm doing this to promote this. I'm doing this because of this. And instead of the, oh, I can't do this anymore, it's I'm doing this because, and having that mind shift is an incredibly powerful thing.
And
Um,
open-mindedness is important even as us practitioners.
oh,
Like, what
100%.
we've learned as a base in school is just a base, and there's so much more out there. So I think as we're growing professionally, we need to be open-minded about thinking about other perspectives too, to understand the root cause of what's going on with our patients as well.
Yeah. Okay, Amber, I would love for you to share with us two things really quick. What's one thing you're listening to and what's one thing you're reading?
Oh, geez. I'm listening to every podcast. I'm reading right now. I'm reading Fast Like a Girl, and I think I'm not a huge intermittent fasting advocate, but it's opening my eyes to some things, especially for women with their hormones. I think that's really important. And podcasts, I am listening to Skinny Confidential a lot, but also Andrew Huberman, just lots of different things. So, yeah, just always learning, I think. Although I do think it's important to get outside of your learning activities and read some other books and do some other things, but I tend to lean a little bit more into that.
Yeah, same, same. All right, what does functional roots mean to you?
I would say functional roots is really about the foundation of our health. And when we think of, I think of root cause, and I think of if we're going to get to the root cause, we need to know what's happening with all the systems of our body and really bring our body's ability to self-regulate and heal to the forefront. And so I think it's just always taking that approach that dives deeper and that sets your foundation for optimal health long term.
Awesome. That's one of our final questions, but I do want to just let our listeners know where they can find you and follow you. So if you could share where our listeners can locate you and let us know where you're at.
Yeah, I would say I'm mostly on Instagram at naturallyamberwhite, but you can also find me on my website, which is naturallyamberwhite.com, and info@naturallyamberwhite.com is my email if you ever had any questions or thoughts or anything.
And you do have beautiful posts. I can get in the weeds with all of the great information you share on Instagram. So
Very much. Thank you so much for joining us today, Amber. So, thank you for tuning in to today's episode of Functional Roots Podcasts. Don't forget to subscribe and follow us to stay connected. And you enjoyed the episode or found it helpful, we'd love for you to share it with a friend.